Prostate cancer is the second leading cause of cancer deaths among men worldwide, making it crucial to understand the warning signs and potential factors that may increase your risk. Before we start, it is important to know that prostate is a small gland in men that is located below the urinary bladder and in front of the rectum. It plays a crucial role in the reproductive system by producing fluid that nourishes and protects sperm. At the end of the video, we will do a fun quiz about this topic. So watch the video all the way through. Now let's discover the 7 key symptoms of prostate cancer that every man should be aware of. Number 1. Blood in semen or urine. As prostate cancer grows, it can invade nearby blood vessels, leading to bleeding. This blood can then be passed out in the urine or in semen during ejaculation. This tumor can also cause inflammation in the prostate gland, a condition known as prostatitis. This inflammation can irritate the tissues in the prostate, leading to bleeding and the presence of blood in the urine or semen. It is important to note that not all cases of blood in the urine or semen are necessarily due to prostate cancer. Other conditions such as urinary tract infections, kidney stones, or benign prostatic hyperplasia can also cause similar symptoms. So if you experience blood in the urine or semen, it is important to see a healthcare provider for further evaluation and testing. Before we continue, if you find this video helpful, please give it a like and share it with your friends. Number 2. Trouble urinating. The prostate gland surrounds the urethra, a tube that carries urine out of the body. Hence, when the prostate becomes enlarged due to tumor-like cancer, it can squeeze the urethra, making it difficult to urinate. This can lead to symptoms such as painful urination, also known as dysuria, weak flow of urine, and difficulty starting urination, which is also known as urinary hesitancy. Number 3. Erectile dysfunction. When a man experiences erectile dysfunction, it may be due to blood flow or nerve issues, which can also be a symptom of prostate cancer. As the cancer grows, it can put pressure on the nerves and blood vessels that are responsible for erections, leading to erectile dysfunction. It's important to recognize that not all cases of erectile dysfunction are linked to prostate cancer, but it's essential to monitor your health and seek medical advice if you notice any changes in your sexual function. Early detection of prostate cancer can greatly increase the chances of successful treatment and recovery. Number 4. Bone pain. Prostate cancer typically develops slowly, but in some cases it can be aggressive and spread to other parts of the body. When this happens, it may cause pain in the back, hips, or pelvis. The reason for this pain is that prostate cancer can spread to the bones. When cancer cells spread to the bones, they can weaken them. This is known as bone metastasis. In the case of prostate cancer, bone metastasis most commonly occurs in the spine, hips, and pelvis. This brings us to another one of the less common symptoms, which is weakness or numbness in the legs or feet. This can happen when the cancer spreads to the bones, putting pressure on the spinal cord or the nerves that control the legs and feet. As a result, signals from the brain may not be able to reach the lower part of the body as they normally would, causing weakness or numbness. It's important to note that not everyone with prostate cancer will experience these symptoms, but it's still crucial to be aware of them. If you do notice weakness or numbness in your legs or feet, it's important to speak with your healthcare provider as soon as possible. Number 6. Pain when sitting. One major factor is the location of the prostate gland in the body. As the cancer grows, it can put pressure on surrounding tissues and organs, leading to discomfort or pain, especially when sitting for long periods of time. Additionally, prostate cancer can spread to the bones, including the bones of the pelvis, causing further pain and discomfort in the sitting position. Number 7. Frequent urination. When the prostate gland becomes enlarged due to cancer, it can put pressure on the urethra, causing it to become narrow. This narrowing can lead to difficulty in emptying the bladder completely, resulting in the feeling of needing to urinate more often. Prostate cancer can also irritate the bladder, causing it to become more sensitive. This increased sensitivity can result in the bladder contracting more frequently, even when it may not be completely full. This can also contribute to the feeling of needing to urinate frequently. So, what are the risk factors of prostate cancer? Risk factors for prostate cancer include age, family history, and certain lifestyle factors such as diet and physical activity. Men over the age of 50, those with a family history of prostate cancer, and those who consume a trans fats diet are at an increased risk. Here are the 4 things you can do to reduce the risk of prostate cancer. 1. Reduce the consumption of trans fats. Trans fats are artificial fats that are commonly found in processed foods like fried foods, baked goods, and margarine. Studies have shown that men who consume high levels of trans fats are more likely to develop aggressive forms of prostate cancer. Making simple changes to your diet, such as replacing trans fats with healthier fats, omega-3 fatty acids found in fish, nuts, avocados, and seeds, can make a big difference in reducing your risk of developing this type of cancer. 2. Avoid charred meat. When meat is cooked at high temperatures, it can produce chemicals called heterocyclic amines and polycyclic aromatic hydrocarbons, which have been linked to an increased risk of cancer. These chemicals are formed when meat is charred or grilled at high temperatures. By avoiding charred meat and opting for healthier cooking methods such as boiling or steaming, you can significantly lower your risk of developing prostate cancer. 3. Stop smoking and drink less. Smoking is not only harmful to your lungs, but it can also increase your risk of developing prostate cancer. The chemicals found in cigarettes can damage your DNA and lead to the growth of cancerous cells in the prostate. Alcohol, on the other hand, can disrupt hormone levels and contribute to inflammation in the body, both of which are factors that can promote the growth of prostate cancer cells. By quitting smoking and cutting back on alcohol, you can lower your risk of developing prostate cancer and improve your overall health. 4. Increase your vitamin D. Vitamin D plays a crucial role in cell growth and regulation, and low levels of vitamin D have been linked to an increased risk of various types of cancer, including prostate cancer. One of the reasons why vitamin D may help reduce the risk of prostate cancer is its ability to slow down the growth of cancer cells and inhibit tumor progression. So, if you want to lower your risk of prostate cancer, make sure to get enough vitamin D. You can increase your vitamin D levels by spending more time in the sun, eating vitamin D-rich foods, or taking supplements. Now let's start the quiz.